Okay, so first I would introduce myself to the mom, make myself known, tell her what I'm going to do for the baby, and then I'll wash my hands for a full 3 minutes before touching the newborn, which I've already done. So I'm just going to start off by checking the name bracelet of the baby, make sure it's the right baby, and it is, so that's good. Then I'm going to go ahead and do vitals on the baby. So first of all, I would do the temperature, and that just goes in the baby's armpit, and you just hold it under his armpit. And the typical value for that would be 97.5 to 99, and this baby's in the right range. So then I'm going to go ahead and listen to the baby's heart sounds and breath sounds. So I'm going to listen to the apical pulse for a full minute, and the typical heart rate of a baby is 100 to 160, and this baby's in the right range. So I'm going to listen to the heart sounds bilaterally, and I'm going to listen to the breath sounds and make sure there's no crackles, which could be a sign of amniotic fluid that's still in the baby. And I'm going to listen on both sides. And while I'm here, I'm just going to go ahead and listen to the bowel sounds, and I'll listen in all 4 quadrants, make sure that they're active. And everything sounds good. And I'm going to go ahead and check the baby's respirations while I'm here, so I'll just hold my hand over the baby, make sure that she's breathing okay. And the respiration should be from 30 to 60. And this baby's feel good. You measure that for a full minute. So now I'm going to go ahead and move to the baby's head, and I'm just going to feel around, make sure there's no molding. If there is, that's totally normal, and I'll just document that. And I'm going to go ahead and feel the fontanelles, anterior and posterior. And I'm going to feel for the suture lines. And then I'm just going to look around the head and make sure there's no scabbing or bruising or any hematomas or anything like that. And the baby's head looks good. Now I'm going to move on down to the eyes. And with the eyes, I'm just going to look and make sure that they have proper placement and that they're symmetrical. And this baby looks good. And I'm going to check for the creases on the eyes, the folds, because that can be a sign of Down syndrome if the baby did have the folds, but she doesn't. Then I'm going to go ahead and check and make sure that the sclera is white, because if it's yellow, that's a sign of jaundice. And I'm also going to check for discharge or any hemorrhaging or anything, and the baby's eyes look good and clear. Now I'm going to check the ears, and I'm just going to take my finger and make sure that the ears are level with the eyes, and they are. And there's no discharge coming out of the baby's ears. So next I'm going to check for their cartilage. So I just take the top of the ear and fold it down, check for recoil, and on the side, check for recoil. And a normal baby's cartilage should bounce right back. And this baby's does, so that's good. Now I'm going to go ahead and check the baby's nose. I'm just going to check for a patency of the nares. So I'm going to cover up one nostril, and with the other hand I'm going to feel and make sure that I can feel the baby breathing. I'm going to do that on both sides, which looks good. I'm going to go ahead and put gloves on so I can check the baby's mouth. So I'm going to start by checking the corner of the mouth and make sure that the baby will root to my finger for that rooting reflex. Then I'm going to get inside the baby's mouth and feel all around the top and make sure there's no holes or anything in the top palate. And then I'm going to let the baby suck on my finger to make sure that the baby has a sucking reflex. She does. Next, I'm going to check the baby's neck. So I'm just going to feel around all over her neck, check for any masses or any swollen lymph nodes or anything like that. Everything feels good. And I'm going to go ahead and turn the baby's head gently to both sides. Make sure the baby has full range of motion, which is good. And I'm going to go ahead and check for the clavicles, make sure there's no swelling. Check for fractures. This baby's clavicles look okay. And now I'm just going to do an overall check of the baby's skin. So I'm going to start with the face, and the face has no bruising, there's no stork bite, nothing like that, so the face is good. And I'm going to check all around the body for peeling, cracking skin, lanugo. I'm going to check for any cyanosis, which I don't see any. And look for vernix, which is that cheesy substance that comes out on the baby when they're born, which is totally normal. And I'm also going to check and see if the baby is jaundiced anywhere. But the baby's skin looks good. And while I'm checking skin, I'm going to go ahead and check the turgor. And I'm just going to pinch a little piece on the thigh and let go, and it should go right back down to where it was. So this baby's skin is good. And I'm going to check for jaundice in all the areas, so the sclera and the skin. Everything looks good. I don't see any jaundice anywhere. And now I'm going to go ahead and make sure that the baby's not having any respiratory distress. So I'm going to check the nose and see if there's any nasal flaring. This baby doesn't have any. And I'm going to listen for any grunting or any sign of adventitious breath sounds or anything. And I don't hear any grunting, and I don't see any recoil in the baby's chest, and I don't see the seesaw where the baby's abdomen goes in when the baby breathes in and when it pops out when the baby breathes out. So that looks good. I don't see any signs of cyanosis or anything. So I don't notice any distress. And now I'm going to go ahead and take a look at the abdomen. I'm just going to make sure that the abdomen is soft and non-distended. Everything looks good. And I've already listened to bowel sounds. And I'm going to take a peek at the cord. And her cord is drying out, so that's good. There's no discharge. So everything looks good there. I'm going to go ahead and put on gloves so that way I can look at the baby's genitals. And with a little girl, the major thing is checking that the labia majora covers the labia minora and the clitoris, which hers does, and I don't see any discharge or bleeding or anything. And if this were a little boy, I would check to make sure that the testes have descended and that there's rugae on the scrotum. And also, if the baby was circumcised, I would check the circumcision to make sure that's healing okay. So this baby's genitals look good. So I'm going to go ahead and remove my gloves. Now I'm going to check the baby's muscle tone. And to do this, I'm going to take the baby's arm and I'm going to fold it up, hold it there for a couple of seconds, bring it back down, and baby's arm should recoil right back up. And this baby's did, so that's good. And now I'm going to go ahead and look at the baby's palmar creases. And those are just the lines on the hand, making sure that she has palmar creases and it's not just one crease, because that would be an indication of Down syndrome. And the baby has multiple, so that's good. And I'm going to go ahead and look at the sole creases, which same thing, the baby should have multiple creases, and she does, so that's good. Now I'm going to look at all the baby's fingers and toes and make sure that she has 10 of each. Everything looks good. And I'm going to go ahead and do the Babinski's reflex. And the baby's toes should fan out. Okay, now I'm going to go ahead and flip the baby over. And I'm just going to look and make sure that the hips are symmetrical, which they look like they are. And I'm going to make sure that there's no tufts of hair or dimples towards the baby's bottom, because that could be a sign of spina bifida. And I'm also going to check for lanugo and vernix on the back. And that's a little bit is normal. And this baby doesn't have any tufts of hair or anything like that. And the spine looks good. I'm going to flip the baby right back over. And I'm going to go ahead and check the Moro reflex. And how you check the Moro reflex is you either clap your hands or you hit the table, and the baby should get startled and abduct and adduct their arms back in. And that's a positive Moro reflex. So I'm going to go ahead and clap, see if the baby has the reflex, which is good. And I'm just going to overall check the whole baby's behavior during the whole assessment and make sure that the baby's responding to stimulus correctly. And everything looks good. And I'm going to talk to mom a little bit and see if the baby is voiding okay, and if they have a stool, what it looks like, the consistency, all that. Making sure that mom is okay with feeding and making sure the baby is eating, and if she needs any help with breastfeeding or anything. And just making sure that everything is going okay for mom, and see if she has any problems with baby. And that is the newborn assessment.